Oh, a guy.
All right, let's look here.
So, I
This-
have a quick question.
Yes.
So, like on the test, on the practical, you just put an arrow on one of the right of those spots and that's.
Yeah, that would be something we could do. Yeah, that would be fun.
That's actually the whole practical.
Everybody's just gonna gather around.
But what you need to do is practice a little bit with the models around here and the skeletons and to make sure you can identify most of these things. Here, what is this right here, this white area?
The tendon.
That's the tendon of the temporal muscle, temporalis. Okay? Now, here we see the zygomatic arch intact. Here it's been removed to show the insertion onto the cornoid process. What is this muscle here? That's the buccinator. The buccinator.
The bucca.
Is that your favorite muscle?
No.
No, the sternocleidomastoid.
No.
Jeez, Emily, get with it.
I don't think
Now-
I was here for that.
Talking about the sternocleidomastoid, the name tells you everything you need to know. Sterno, cleido, mastoid. Typically, we think of its origin as being the manubrium of the sternum and the medial third of the clavicle. It inserts upon the mastoid. Its innervation is what? Accessory nerve. Yeah, number 11, lucky number 11. Now, when it contracts, it moves the head. It rotates the head to the opposite side. Now, when the sternocleidomastoid, when the right and left sternocleidomastoid contract together, then we refer to it as the prayer muscle. Watch this maneuver. Okay? In other words, you bow your head, you flex your head and neck when both sternocleidomastoids contract together.
I'm sorry.
You would also use it, for instance, if you want to say yes.
No.
Okay? I'm not recommending that. But I'm saying if you say yes, that involves contraction of sternocleidomastoid.
So when you ask us like the function of a muscle, can we say like it's used to bow the head or to say yes? Is that
Yes.
what you mean?
Right, you could use it to flex the head and neck, or you could say it to rotate the head to the opposite side. Like this. Now, that's assuming that the insertion is at the mastoid. The insertion is at the mastoid. Because sometimes people will reverse the origin and insertion. What do I mean by that? Sometimes the mastoid can serve as the origin, and the manubrium and the clavicle can serve as the insertion.
If they're going backwards.
Now, in that case, they're
Like you
using the
with clothes on?
sternocleidomastoid as an accessory muscle of inspiration. As an accessory muscle of inspiration. Now, during quiet breathing, like when you're all sitting here, just breathing quietly, do you use the sternocleidomastoid? No. The two muscles you use are the diaphragm and the external intercostals. We'll talk about those. But just taking a quiet breath in, you contract the diaphragm and you contract the external intercostals. Inspiration, quiet inspiration is an active process. It requires energy, which is used to contract those muscles. On the other hand, quiet expiration is a passive process. It simply involves relaxation of those two same muscles. You relax the diaphragm, you relax the external intercostals. So inspiration is active, expiration passive. Now, if you work in an emergency room, you will undoubtedly see pediatric patients who come in with asthma. Asthma is a condition associated with reversible bronchospasm, where the smooth muscle within the walls of the airways contract. And as a result, the airways undergo spasm, which results in obstruction of airflow. So those children have to work even harder to move air across those narrowed airways. So then they begin to use accessory muscles. Okay? Those accessory muscles, what they allow for is greater expansion of the thorax. to allow the lungs to expand even more and pull more air in. Okay? So when we use the mastoid as the site of origin and the manubrium and clavicle as the sites of insertion, it allows us to pull up on those bones, to pull up on the manubrium and pull up on the clavicle to expand the thorax. Yes?
So not just in asthma, but like, can it happen when people are like really out of breath, like working out
Yes,
too?
yes. So to take a deep breath of forced inspiration, you're going to go beyond just the diaphragm and external intercostals and utilize accessory muscles of inspiration, like the sternocleidomastoid. For centuries, the sternocleidomastoid was considered an object of beauty. That women who were considered beautiful had very prominent sternocleidomastoids. Okay? It's funny how standards change. But once you learn about the sternocleidomastoid, it's hard not to notice it in individuals. How many people think they have a nice sternocleidomastoid? I will tell you this, and sometimes I'm wrong, but I want to demonstrate the sternocleidomastoid. Brittany, would you mind coming up here?
You have before. You used Sarah and me.
Yeah, you have.
Okay.
Sarah
Well,
had the best one.
No, I didn't. Somebody else, I think Jordan did.
Jordan.
I want you to turn this way so they can see your sternocleidomastoid. Pick up your chin just a little bit. And even at rest, I think, this is interesting. Even at rest, look here.
Yeah.
Do you see the insertion into the sternum? And then you get the feeling that here's the other tendon here coming onto the clavicle. Take a really deep breath. Out. Take a deep breath. Do you see it contracting? Okay? Thank you. And so we showed it before with Jordan, I think. So when a child comes in who's struggling to breathe, with each inspiration you can see flaring of the sternocleidomastoid. And the physician, the emergency physician, will note that on his physical exam. When he gets to the respiratory portion, he'll say that the patient exhibits accessory use of the muscles of inspiration. Okay? Or he'll specifically say there's flaring of the sternocleidomastoid. As that child responds to treatment, what happens? The accessory muscle use declines. That's a sign that the patient's improving. Here's a lovely sternocleidomastoid. Again, number 14 in this case would be the tendon to the manubrium. We don't see the other tendon quite as well, but you can see the anterior margin of the muscle here. This person has a condition called, this is not a funny condition at all, actually. It's called torticollis. It can be painful. It's
me on
it's
Snapchat.
really a chronic type of spasmodic condition of the sternocleidomastoid. And it can be really debilitating. It's not only awkward in terms of social interaction, but it can be painful if there's enough spasm. There was a 16 Minutes segment, it must have been about 20 years ago, I still remember, about a patient who was fired from his job because of torticollis.
Really?
Yeah, he worked for an insurance agency, and the employer felt that it interfered with picking up new clients, that his physical disability interfered with picking up new clients. And back 20 years ago, we really didn't have any real good treatment for this. We would use muscle relaxants. We'd use things like Ativan or Valium back then. But a lot of side effects associated with that. Sleepiness, drowsiness.
Just a smidge.
Sometimes slurred speech. Now, what do we use? We now have a very effective treatment for torticollis. What is that? What's the current treatment for this? Oh, come on, folks.
Muscle relaxers. Maybe?
Botox.
Oh.
Botox, yeah. You can inject the muscle with Botox. And the trick is proper titration. You don't want to completely paralyze the muscle. You just want to prevent spasm. How does Botox work, by the way?
Paralyzes the muscle.
How does it do that, though?
It's like freezes it, right?
No, injects it with
Isn't it like a top?
Thing.
Isn't it technically like
It
a
would
toxin?
block
So
the plate.
Motor end plate.
are you making a point?
Okay,
No,
here are the
that's
synaptic
fine.
vesicles. Remember, along the postsynaptic membrane, you have nicotinic receptors for acetylcholine. Now, normally, when an action potential reaches the axon terminal, it triggers opening of voltage-gated calcium channels that allow calcium to flood into the cell. Okay? When calcium floods into the cell, it brings about fusion of the synaptic vesicle with the presynaptic membrane, releasing acetylcholine. What Botox does, or botulism toxin, is it interferes with fusion so that you can't release the acetylcholine. If you can't release acetylcholine, then the muscle can't contract. Corticops. All right. I threw this in here. What cranial nerve are we talking about here with this figure? Trigeminal, right. We see the three different divisions: ophthalmic, maxillary, and mandibular. And just remember that the mandibular division innervates the masseter and the temporalis. Now, when we do a physical exam, specifically a neurologic exam, we assess cranial nerves 2 through 12. In assessing cranial nerve 5, we can simply assess for contraction of the muscles of mastication. We can feel over the temporalis muscles and have the patient bite down. And in a similar way, feel over the masseter muscles and have the patient bite down. And if we can palpate contraction, then we know that the motor function of the trigeminal nerve is intact. By the same token, this is the way we check for 11. We have the patient turn their head against resistance. And if we can't push the head back toward midline, it means they have good muscle strength in the sternocleidomastoid. And you can see it contracting right here, which indicates that you have an intact accessory nerve. Here's a picture of a cadaver. What nerve is this right here?
Trigeminal.
Yeah, here's the ophthalmic division, the maxillary mandibular. What is the opening through which the ophthalmic division travels?
Superior orbital.
Superior orbital fissure. What's the opening through which the maxillary division? That's the foramen rotundum. Look at this branch, by the way. I don't know if you can see, there's a branch coming down here. And it's dividing a little bit, but it's providing innervation down here to the upper teeth. What is that called? Not inferior, that would be superior alveolar nerve. So it's a branch of the maxillary division. It provides sensory innervation to the upper teeth. All right, here's the mandibular division that's passing through what opening? Foramen ovale. Okay, and a branch from the mandibular division is passing down into the mandible and providing innervation to the lower teeth. What is that branch called? Inferior alveolar nerve, right. Okay. Now, I think what we'll do now is take a little break. And then we'll finish up with the muscles of the axial skeleton in just a little bit. Let's take at least a 5-minute break.